We are here to provide the best care for children. And as you reflect on how you provide care for children, it occurs to one that you must understand the process that leads to the care. If you can standardize that process, if you can make sure that process is available to everyone, then the results will be the same every time. It is part of our culture, understanding a process, and if there is no process, asking should there be one, or how do we create one? That's really what Lean is all about.
At Miami Children's Hospital, we have taken steps to ensure long-term sustainability by embedding Lean methodology in our culture. The application of Lean tools is a required goal of all our management staff. We have a robust Lean education program and unwavering support from our senior leadership team.
Improving patient flow in the hospital can be accomplished using Lean methodology. In manufacturing, flow is accomplished by producing goods based on attack time and also allowing small amounts of working process inventory. Using queuing methods, spaghetti flow diagrams, and Heijunka, flow will be optimized, which will help drive customer satisfaction throughout the hospital.
We took on this crash cart process because the process to check the crash cart each month for each nurse, for each unit, we have 30 crash carts at this time. The process was very tedious. It took about 3 hours for each nurse to check one crash cart.
We all got together, each unit brought their carts. What we did was we opened the carts to evaluate what we needed, what was excess, to make it leaner and more efficient so that when we needed an emergency, it would go faster for us because it's very easy, it's very visual to see what you need, where it is when you need it.
The nurses' time spent on each crash cart to check it every month went from 3 hours to 10 minutes. We are talking about $30,000 annually that we are saving at this time. I mean, this is what Lean is all about.
One of the things I'm constantly reminded of is Lean is a tool. It's a toolbox of tools that we have an opportunity to leverage in order to make sure that we're delivering operational excellence. And one of the things I like to say is Lean isn't one more thing or one more project, it's how we do everything we do here at Miami Children's.
When we first heard about the Lean initiative at the institution, it was an exciting opportunity for us to begin evaluating our processes within the laboratory in ways that we hadn't considered before.
Our first thought in the blood bank was to reduce our blood product waste, which was always a challenge in the transfusion service. We really started by getting the commitment of all the stakeholders, that's including the senior leadership, physicians, nurses, and technologists. And I can happily say that during the 4 year, we were able to reduce more than 80% of our total waste, which helped tremendously, not only with the money that we were wasting, but also with the availability of the patients to have the products ready when they needed it.
We have to engage everybody on our team to develop an appreciation, understanding of what Lean is, which is what was done. And once we did that, opportunities to apply that methodology in our routine applications became very apparent.
You bring in staff and you gain insight from the staff, and that's where the beauty of it, because you brainstorm with the staff and then they realize this is not just for leadership to lead and make decisions for their own workflow. This is them being part of the workflow and being part of the decision making.
What's really nice at Miami Children's Hospital is we ensure that the education of Lean is coming from the bottom up. We train all levels of staff, and education is provided to all levels of staff and is available to everyone.
We start at the point of entry from when an employee comes in. So at the time an employee is hired and onboarded, we actually teach them about Lean. And we've seen a significant amount of growth in our Lean program that obviously is now to the voice of the customer, which enables us to actually go to the families and ask them what they want to accomplish as far as efficiencies and how we can help them as part of their transparency in the care of their children.
Our Lean success story is about our multidisciplinary team effort to reduce the incidence of unplanned extubation. Our team of doctors, nurses, and respiratory therapists use the value stream mapping process and lean principles to help us better understand our process and also identify process breakdowns. Unplanned extubations have decreased at Miami Children's Hospital by 70% since our lean initiative was implemented in 2009.
The main thing that lean has done for us as the physicians, it makes us realize what other individuals are involved in all the processes that go on at Miami Children's Hospital. You realize that it's not just dependent on you, it's dependent on many other people in the process. At the same time, we realize that there's a lot of waste within the system that we can get rid of and make the process more efficient.
Senior leadership assigned an objective to supply chain to establish a standard distribution method for Miami Children's Hospital, to optimize stock in our department, to reduce our overstock, to reduce stock out, to reduce expired supplies while improving our inventory turns. We completed process maps and value streams for all the methods being evaluated. At the end, the method that we chose was a 2-bin Kanban utilizing a automated control, a jitterbug control, to send an automatic replenishment signal back through our ERP system to replenish a bin quantity. Supply chain is savings $100+ a day versus the labor to push a button by the nursing care staff equals $5 labor a day for all stations deployed. So we're seeing very good benefit from our initiatives, and it was all based on lean principles and evaluation.
Lean requires the discipline of accepting that processes drive care and drive business. We are now at a stage where, having accepted that in the culture, we're going to take it to the next level. And building the entire lean methodology around communication is the virtual next step. We have a name for that. It's kind of a cute name. We call it Lean Next. But if you look at it, there is no organization in the world that has really taken on the concept of standardizing communication using the lean methodology. We believe that will really change the paradigm. And it'll take a couple more years, but I think yet again Miami Children's will be at the forefront of this movement.